Hi, good afternoon, everyone. I want to thank you for joining this week's edition of Policymakers Live. My name is Susan Martin. I'm the Director of Government Affairs here at MassBio. I just want to give you a quick overview of today's event. We'll begin with a one-on-one discussion with Bob and our special guest, who he'll introduce momentarily. That will last approximately 20 to 30 minutes, which will be followed by Q&A. We would welcome your questions if you could just go to the chat box at the bottom of the screen and enter your questions there, and we'll do our best to get to as many questions as time allows. Thanks again for joining, and I'll turn it over to Bob.
Thank you, Susan. Thank you so much. And to all of you, welcome to this week's edition of Policymakers Live, which is our new series of virtual briefings that we're holding in the coming weeks and months with members of the legislature and the administration. You know, while the world has shifted dramatically in the last 2 months, policymaking in Massachusetts has not slowed down. So we wanted to create a new platform for our members to directly engage with the legislators and members of the administration in lieu of the traditional avenues of what we're all used to, because as you know, they're not currently available that way. You know, and I just want to really start off with an immense thank you to our sponsors of the first series of Policymaker Live events, which is during the entire month of May. I want to thank Alexion, Amgen, BMS, Pfizer, and Takeda. Thank you for helping MassBio continue to advance our mission of making Massachusetts the best place in the world for the life sciences. We could not do it without your support. Now, I want to introduce our special guest today. I want to welcome Senator Boncore to this week's edition of Policymakers Live. He's a wonderful, terrific supporter of the life sciences industry. He was elected in a special election back in 2016 to represent the 1st Suffolk and Middlesex District. He secured the Democratic nomination after beating 7 other candidates and then won the general election in May. He's been appointed as chair of the Joint Committee on Transportation in January 2018. But most importantly for our purposes, ladies and gentlemen, for those of you who may not know, he is also the Senate chair of the Mass Biotech Caucus. So, you know, Senator, I'm always looking forward to talking to you, but I'm looking forward to hearing your thoughts on how things have changed, the Senate's plans for the rest of the session, and, you know, how you're thinking. Traffic is not bad right now, but it will be again. So we're going to talk about that, Senator. But first, let's start off. Welcome, ladies and gentlemen. Welcome, Senator Joe Boncore. Senator, how are you doing? How's your family doing? How are the babies doing? And how are you guys adapting to this new world that we're living in the Senate here in Massachusetts?
Hi, Bob. Thank you for having me. And of course, thanks, Susan, for all the work you've been doing in really supporting the life sciences industry across Massachusetts. General thanks to the life sciences industry for stepping up at a time when we needed you most in the Commonwealth's history. The immediate adaptions you've made to help our supply chain issues and fill in where we needed some help was just remarkable. It will not be forgotten in this building, and I assure you that. You know, my family's doing well. We're spending a lot of time together. You know, the 2 boys are, you know, they're 7 months old now. Their adjusted age is 4 months old.
Wow.
You know, we're dealing with, you know, all the new stuff, but it's been really the pleasure. I'm in the State House today, but I haven't been much. So it's really been the silver lining of all of this is just, you know, the changes that new children, babies have every day, and being able to witness that at home. It's been really special. And, you know, we have a lot of, gave us a lot of hope going through what my wife and I went through, you know, over the last 7 months. But now we're all home. Everyone's, you know, on the right trajectory. You know, at 14 and 11 pounds, they're a little small for 7 months old, but
yeah, they are.
They're getting there. But thanks for asking.
That's great news. Thank you. When you look at how things are going in the Senate right now, how are you adapting to this virtual world? How do I say this delicately? I mean, the art of legislating has typically not embraced the virtual nature that perhaps the private sector has, right? It's an in-person, traditional, you know, very born in tradition that you know, folks get together to meet in the House and the Senate. How's it going?
Since COVID-19 hit Massachusetts, the state Senate has been working to ways to identify and support unique challenges faced by those in our community, families, healthcare workers, obviously, and in my district, specifically small business owners, including restaurants. And, it is different. There's not a lot of, private conversations. There's no whispering going on lately and not a whole lot of backslapping, but we have, engaged in a truly transparent process in the Senate. We've adopted using many of the same technology tools that you are all using in your businesses to remain open. And we're now able really to conduct the entire work of the legislature from home. And we're doing so in the Senate in a very transparent and open process. And we're really able to still address the immediate needs of the crisis, being proactive, reaching out. And we've been able to pass a lot of legislation in the meantime.
Yeah, as far as transparency goes, I mean, you could look at it both ways, but is it something that, how do you have these public discussions when you need to do it in a virtual way? Has it been successful?
Yeah, it has been. I mean, we've been very successful in opening up lines of communication with, consultants, lobbyists, people in the business sector, people who are activists who represent large swaths of our Commonwealth. Through the Senate has set up a kind of a channel of working groups in respective areas. And those working groups have meetings that are open, and all that is kind of, still going on a power up dynamic that the Senate has championed for a long time. Unfortunately, we're not in the Senate, in the, the beautiful chamber, having the same debate we, used to have. And I think really the most transparent process in government is what takes place in the Senate. So we're all looking forward to getting back to there, as quickly but as safely, more importantly, as possible.
Yeah, during this time where we're not back to there yet, so we're dealing with all new ways to do our job. And when you think of the audience that's tuned in to hear from you today, it's folks that work in governmental affairs. It's folks that spend a lot of time in the building. It's folks that work on government relations for their companies and whatnot. What advice would you give to us during this time of remote work? How can, this isn't your traditional constituents back in your district. This is your constituents that are looking to, to influence government in a way that can help promote economic success for their business or whatnot. What should we be doing?
Yeah, I mean, don't go away. Keep up with the advocacy. I think it's necessary for this legislature to be able to conduct business, and like I said, in an open and transparent manner, as we were talking about before. But what's still crucial is the critical information and opinions that we receive from, your public sector, the life sciences industry, and businesses across the Commonwealth. The Senate, like I said, through its working groups and committees, we've been proactive on our outreach, but it's important too that people, constituents and businesses, that they remain proactive in their outreach, I should say. And government affairs people, working through organizations like like yours, Bob. I mean, you have been an incredible partner to both the legislature and the executive in the early process of this crisis, but generally, I mean, even before the crisis. It was important to always hear from you, and to be up to date on how the life sciences industry has adapted in the COVID world. I think it was important to hear from you about getting manufacturing up and running even when other businesses were shut down. So we were able to, in Massachusetts, to produce things we needed to treat people and combat this kind of novel disease. I mean, as we race towards further treatments and eventually a vaccine, we're going to need to hear from MassBio and your companies, what you need for support from the legislature. I mean, we're all in this together. I know that's often stated, but it couldn't be, more true now, especially with an industry like yours that's already in the midst of getting us closer to a cure here.
Yeah, well, thank you for that, Senator. And I mean, we'd be remiss if we didn't thank you and all of your colleagues, because going back to the Life Science Initiative back in 2007, that's when government really decided to step up and say, hey, we're going to partner with industry and we're going to try to become the best place in the world for this industry, for the life sciences. And you did that with a 10-year $billion initiative, and then on under the current administration and the current leadership in the House and the Senate, the 5-year, $500 million initiative. If we did not do that, we wouldn't be able to sit here right now today and say that there's over 70 companies that are working on diagnostics, therapeutics, or vaccines right here in Massachusetts. There are 8 vaccines right now in human clinical trials in the world. 2 of them are here in Massachusetts. And that's because of this partnership, and it truly is wonderful. So thank you for all the work that you've done, because in the Senate, you are a champion. And the conversation has been regular for a long period of time, since the day you've been in the building. So thank you for that. And so it's important that we talk about the life sciences aspect, but can we move on to transportation for a bit? Because one of the coolest things about having the chairman of the Biotech Caucus also be the chair of the Transportation Committee, we coming into the COVID-19, so we're going back, what? I don't know, 12, 13 weeks ago. What was our biggest issue in this industry? It was congestion and transportation. Well, that is not the current situation right now. What does this mean for transportation? You know, the House passed a transportation reform and funding package earlier this year. It's an important first step. In your role, you've been talking about it. You're clearly a leader on it. As you look ahead, is transportation funding still going to be a top priority for the session?
And listen, transportation policy remains a clear priority for the Senate. I talked to the Senate president, this week about the very issue. Obviously, the Senate's been working through a working group that I've been heading up on the myriad of transportation policies that we could implement to get Massachusetts out of the basement as far as congestion goes and lack of infrastructure funding. And we've been engaged in that process since last June. And so when this all hit, right when we were on the brink of moving some major policy, obviously as the chair of the committee, it wasn't the best feeling in the world. But although focuses have changed, priorities really haven't. And I would say, right next to the public health and economic, crises we're going through, and obviously that's the first priority, dealing with that. But transportation is still the second priority. And we're continuing to work diligently on transportation policy. We've been strongly advocating with our colleagues in the federal government to support federal assistance for our MBTA system and infrastructure. And, we've even secured some adequate financing during this downturn. We're seeing on the commuter rail, usage has been reduced to about like 5 to 8%. On the MBTA lines, ridership is down to, between 8% and 12%. So obviously we're losing a lot of funding. So when the federal government can come in and give some stimulus to that sector, although we're not building, the way we want to build, we're able to maintain an adequate level of service, keep people employed, and keep people safe. But in the coming weeks, we're going to be working on policies and moving out policies. As you were talking about earlier, congestion seems to be, I like to tell my colleagues that I solved the crisis in 3 years, but we know that's not true. But what we do know is true is that procedures and policies like work from home policies have really changed the landscape.
Sure.
And it's it's really a priority need as we modernize our entire system. So we're going to be thinking about through that lens, as we come to what the new normal is. How can we still encourage companies to continue working from home like they are now? And in the next coming weeks, we have things we need to deal with. Chapter 90, which is bond money for local roads and bridges at a municipal level. We'll be moving on that. The Fiscal Management Control Board is set to expire at the end of June. I think that body has been, since the crisis of 15 with the shutdown of our entire transit system, I think the Fiscal Control Management Board has been an integral part in getting back to good policy and spending responsibly on the T. So
Mhm.
we need to reauthorize that board in some fashion. And of course, there's a multi-billion-dollar transportation bond bill that the House passed before this crisis that we'll be dealing with in the short term. So, yeah.
Hey, let's go back a bit to work from home. Okay, as you recall, at MassBio, we were coming in constantly, and at times we were pretty harsh on the administration as it relates to transportation issues. We were about to release our MassBio State of Possible 2025 report, a State of Possible 2025 report at our annual meeting that was supposed to be in March, that obviously was postponed because of obvious reasons. That report was going to say that literally the biggest issue we were facing right now is transportation. We had already put into play at MassBio, and we've given best practices to our member companies to try to encourage people to have their employees work one day from home. I'm going to be honest with you. I wasn't a believer, okay? I didn't like it. I wasn't good at believing that people could be productive when they were telecommuting. And thankfully, we got people set up with computers and were able to, everyone was working one day a week, including myself from home. It was a mandatory type thing. And boom, this thing just fast forwarded. Everybody overnight needed to do it. Well, I'm going to tell you, I'm a believer. I don't think we've missed a beat. So I'm amazed at how many things you can do remotely and do it effectively, like meetings like we're doing right now. I would argue that when we do it this way, it's even more inclusive because people have more ability to tap into these meetings now that otherwise couldn't get in and out of the city or had issues that were keeping them or cost prohibiting them from doing certain things. So it's been very good. What are your thoughts? What's your gut? Do you think companies are going to continue down this road of having people who can work from home? And what does that mean for your transportation improvement plan?
Yeah, no, I mean, listen, during the Senate Transportation Working Group, work from home strategies were often discussed in the congestion subgroup of that working group. It's, the concept of telecommuting is something that, everyone was probably feeling the way you were, and quite honestly, the way I am. I mean, I know I'm in the office today. I'm here alone. You're in the office, you're alone. But
Yeah.
I mean, I'm in constant contact with my staff all day. I know some of them are on this call and communicating, and we're really not missing a beat. So perhaps the silver lining in all this difficult time is how many sectors have been able to, sort of make this smooth transition basically overnight. It didn't take a long time for, I know, my colleagues in the State House, workers in the State House, to get familiar with Zoom and Microsoft 360 and team meetings and so on and so forth. So I think it will remain an essential element. I mean, listen, I think we're not going to find our way out of this crisis, for unfortunately, by some measures, for another 8 to 10 months. So we're going to be engaging in social distancing strategy for the time being. And so far, we've seen, the marked improvements to public health with that approach of keeping people at home, if at all possible, and socially distancing appropriately. So I think we need to maintain that, that strategy going forward. And, the best part from where I sit is that we've been able to do this without any sort of economic incentive to big business to see them do that. So businesses, they probably see the cost savings, the productivity of their employees hasn't fallen off too much, I hope. But really, I mean, when we sit in traffic, the average commuter was sitting in traffic for about, over the course of a year, somewhere between, 60 to 80 hours of just sitting in traffic.
Oh yeah, easy.
The work-life balance, but the money lost, the time lost, and what that loss is. When you're sitting in a car, it's difficult to be sending an email. In fact, it's illegal now in Massachusetts.
You bet it is. Yeah, for the record.
Just so everyone knows, I see a lot of people out there, using red lights as stop signs right now. But the rules of the road are still in effect. So, slow down and stop texting and driving.
Hey, one more question or comment on transportation, then we'll bounce back to the COVID-19 piece and the constituent piece, but you talked about Chapter 90 monies, right? One of the things that the administration did do was kept construction projects, road construction projects going along. Is this an opportunity now where there is less traffic to do more of these projects? You put people back to work and you're getting them done in a way that you're not creating more traffic. Has that been thought about?
Yeah, absolutely. I mean, we have been seeing a lot of that. And to be honest with you, when a lot of credit goes to the governor and his administration, especially as it pertains to the MBTA, they spent almost $1.1 billion on infrastructure this year through
Wow.
March, right? And if you think back to 2017, in the entire year, we spent half of that. So they've really ramped up the infrastructure investment. And I think, you're right. With this, when roads are being less used, when the MBTA is, down to, 12%, 8% ridership, we do have that opportunity to take a step back and do some of these improvements. Just this week, work began on the Blue Line, making improvements on the Harbor Tunnel that runs between Aquarium and Maverick Station. So, from Maverick Station in East Boston, the Blue Line has now shut down, and we're able to implement, a pretty robust bus policy where buses are picking people up at the station, 2 or 3 buses at a time. So we're not really losing the capacity we have. But when there's no roadway congestion, buses can zip through the tunnel, and we can kind of get some of the, we can kind of fast track some of these infrastructure projects dealing with resiliency and safety and reliability of the system. Because we're going to need, we've been trying to move people out of their cars onto our public transit system, whether that's commuter rail or the bus network. And what we've seen time and time again in the past 3 years I've served as chair of the committee is we need to build trust in that system. So it needs to be safe, reliable, on time. It's going to be interesting as we come back, Bob, to see. It's going to be a different type of trust people are going to need in that system. They're going to need to trust that they're safe when they get on the MBTA or the commuter rail, and that the T is really implementing strategies to help people socially distance, wear masks, and stay safe. What we don't want to see, and what could be an unfortunate conclusion to all of this, is people are going to get back in their cars and get on the road because you're going to be safe, until we find a vaccine. So I think, other municipalities, other states are implementing pretty detailed processes on how they're going to socially distance and keep the commute safe in the morning. And we're working through that currently.
All right, yes or no answer on this one. It's an easy one. With the House extended deadline, Ways and Means to file the budget to July 1, do you envision that formal sessions will go beyond July 31st deadline?
We haven't really discussed that. I mean, it's an ever-changing, situation up here. We have some members who are in election years, and we have some people who are not coming back. So it's been the typical course of the legislature to have a hard stop on July 31. In my opinion, I could foresee us coming back and doing some things into September. But there have really been no discussion. There's been no discussion, I can tell you, in Senate leadership regarding that as of yet.
Okay, so there's no yes or no to that.
No. I'm still a lawyer, Bob.
Yes, that's wonderful. All right, let's go to your district, all right? I mean, you represent hospitals that are on the front lines of this epidemic, and you also represent a boatload of small businesses and a ton of restaurants, right, that have been so heavily impacted by this crisis. What are your thoughts on the first phase of reopening this week?
I'm cautiously optimistic. We've done a lot of work in the legislature to assure that the health of our, people on the front lines is the #1 priority. The patients, who have Mass Health, the GIC, the government insurance company, we were waiving copays, waiving deductibles associated with any COVID testing or treatments. We want people to be able to have access to hospitals. We want to ensure workers are safe. And in the restaurant industry, immediately we took the steps in as far as unemployment goes, to kind of widen the breadth of who could apply for unemployment and ensure that typical, waitresses, wait staff, back of the kitchen people, people who typically, couldn't get real unemployment, were able to get it. So it's been, front of mind since this pandemic came across. We waived the 1 week waiting period for people that have to, receive unemployment. But, as we reopen, we have to, we're not just flipping a switch here. And this isn't just, all right, we're open now. It's still a slow and steady process. Restaurants are not in phase one currently. You're still able to take out, and, we've tried to make things as easy on restaurants in a very dire situation, giving them the ability to not only take out food, but take out alcohol, because we know they're losing a lot of their sales on that. And the legislature's seen that. We provided some relief as far as tax payments and quarterly, deadlines go. So we're trying to do what we can. There's 16,000 restaurants in Massachusetts. About 80% of those have closed. The epicenter of restaurants in my district, the North End is, restaurant owners are starting to, wonder what their future is going to look like. And we're going to be working with them every step of the way to do what we can to assure that they can, open a business, hopefully not too soon, where people are not ready and don't feel safe to go into a restaurant, because that could just set them back even further. But be able to open a restaurant, have everyone safe, socially distancing, and, restart this economy.
Cool. Hey, folks on the audience, feel free to use the chat function to ask any questions. Until I see any there, I'm going to ask you, Senator, public health and wellness. A couple things. First, people have passed on routine healthcare because they haven't been able to access it, right? Yeah. I mean, what do we do? What can government do to encourage people? Because we could be facing another issue down the road for people that have put off taking care of routine health issues, and maybe throw in there where telehealth fits in. I mean, I have had a telehealth appointment. My son with CF has had 3 of them during this period. I mean, it works pretty good. I mean, Could this be a reason to accelerate telehealth?
Yeah, I mean, I think it has been. I've been a long supporter of telehealth. I have a standalone bill in the Senate. Since my boys have been home for 7 months, obviously there was some, less routine visits that we had to do in person. But now they're getting, they saw their renal doctor last week on a telehealth visit. They do early intervention on telehealth. And I think people are starting to really see, how that process can work, and, how much can be done in that way. And, we want to make sure hospitals are safe, because we understand that, some people are still going to have to go into the hospital for more invasive procedures, or any procedure really. So we're doing our best to ensure that, to expand who can practice in Massachusetts. We understand that there's a new demand, and to meet that demand, we're going to need more nurses, more doctors. So we've waived some requirements to get more nurses on board, accelerated doctors' graduation dates, to really ensure that we can still manage, the health problems that we had as a community and before this all hit.
Yeah, we do have a question from the audience, and it's a great question. Daycare, summer camps, etc. Obviously very important to any real return to work. Is the Senate talking with the administration about how to safely and quickly reopen childcare? Otherwise, we can't have a real reopening.
Yeah, no, I mean, it is a great question. It's a question that comes up a lot. We had a Senate caucus with the lieutenant governor last week, and that did come up. And, I think we have expanded in the reopening phase, or the administration, I should say, who's entitled to who's entitled to kind of partake in the emergency daycare system that we had previously set up for emergency and frontline workers. So that scope's been expanded. But the person who asked the question is absolutely right. Immediately, in order to open up this economy, get people back to work, over a longer period of time. We're going to have to think about where students can go and how to keep them safe, excuse me, not sick. Because, children, although they're asymptomatic, they can still be carriers. That's what a lot of the research suggests. So we want to make sure that they can adequately social distance and do it what they need to do, so they're not bringing home any sort of disease to their parents, grandparents, or so on and so forth. So, it seems like we've done pretty well keeping everyone at home. So, it's my ultimate hope that we're not moving backwards in this reopening.
Hey, we're going to close up shortly here, and we can't thank you enough, Senator, for taking the time. We know how busy you are. We truly appreciate having you in the Senate as an advocate for the life sciences, and you are so committed to patients. So thank you for that. But, with adversity and with crisis, can come opportunity. And we've heard people talk about, any of the silver lining that come from something like this. And again, this has been a horrible time. Way too much life has been lost. This is catastrophic, right? What people and families are going through. But let's try to end this out on a positive note, because I have a whole list of things that I think we're going to be able to do better after this. What do you think?
I think we've seen a lot of efficiencies in government come better. This has shed an incredible light on the infrastructure that needed immediate assistance. Our unemployment system, the way we did business there, it was an old and aging infrastructure, and we were able to rebuild it in a matter of weeks. We have 650,000 people on unemployment right now in Massachusetts. And that system, typically would have about 300 cases a week. In a month, they had 650,000 cases. So we've had an opportunity to kind of see what's working, what's not working, how to rebuild infrastructure. Obviously, things like, understanding how telecommuting works, can be very, very helpful in solving a congestion crisis, during peak hours on our roadway. So there's going to be, I think, other silver linings that come out of this. People are going to be closer as families. People are going to be closer as colleagues. There's a lot of humanity that we've seen go on, from your industry on down, of these, heroes among us in these stories that we hear. And, I'm hopeful going forward. I'm looking forward to see and experiencing what the new normal is. And hopefully it is, more humanity.
Yeah, I mean, the humanity has been amazing. And to see these Folger just brought up a point through the chat function saying that the public and private partnerships have been extraordinary. And, what is it that we're going to do to continue to move that, keep that happening moving forward? And I'll tell you right now, Folger, from our standpoint, I have never seen, and I've been doing this here at MassBio now since September 1st, 2007, that the communication and partnership between government right now is truly amazing. Granted, it's because we have to, right? That common enemy that's out there tends to draw people together. But I never would have thought ever in my lifetime that the most important thing to the entire world's economy would be a vaccine. We're in the industry of inventing vaccines. As parents, Joe, you and I have talked a lot about how important this industry has been because of situations that we've been through with our children, right? Anybody who's a patient really understands the importance of this industry and the value of this industry, especially if you're experiencing life and death situations, right? So for me right now, and all of us in this industry, it almost feels like our neighbors and our extended family members and our friends and our partners in government and our colleagues, everyone understands that everyone kind of knows what it feels like right now to need a medicine so that they can stay healthy or so that they can just go back to some sort of a normal life, right? That's what people who are suffering from rare genetic disorders and cancer and all these other diseases have felt all along. Well, now our whole world needs that. And the only way we're going to pull through this, the only way we're going to get out of this is science, right? And the only way we're going to be able to create that science is if academia, industry, and government that already worked pretty well together here, we're going to do it even better. and we're not going to stop. And the teamwork that I see amongst our companies, the sharing of data and sharing of information so that we can take what in the past would take 5 to 15 years to invent a vaccine and compress that down to anywhere from 5 to 15 months is extraordinary. It's unbelievable. And, you know, I'm pretty excited about it. And I know we're going to get through it. And I know that we're going to be okay. I know that it isn't easy, but I do know that we have amazing people like you serving in government. We can't thank you enough for what you do each and every day.
Well, listen, we're only as good up here as the information we get from all of you. So keep that information coming. Let it be known the good work that the life science industry is doing, not just today, but has been doing and will continue to do to lead us out of this process. You know, stay front of mind, and I think people are really going to take notice of the incredible industry that we have, you know, right in our backyard. Certainly in my district, I want to thank all the companies that have joined. Bob, thanks for engaging and having these conversations. You know, and we will work our way out of this together. And look forward to see everyone on the other side of this.
That's right. Well, thank you, Senator. Hopefully you can have somewhat of an enjoyable Memorial Day weekend. Enjoy that beautiful family of yours, and thank you for your service. It's much appreciated. Folks, I just want to let you know that our next episode of Policymakers Live is going to be on Friday, May 29th at 11 o'clock, and we're going to have Chairwoman Marjorie Decker join us, and we're going to talk about mental health issues, mental wellness, and literally the epidemic that we could face as it relates to mental health as a result of this crisis. So I hope you can join us. We appreciate you being there, and all of you in the audience, thank you for what you do each and every day for patients. We truly appreciate it. Sign off until next time. We'll see you, Senator. Thank you again.
Be well.